And I would like to acknowledge Dr. Leong Keng Hong because some of the slides that I'm using actually also was used by him previously. In a way, this topic is very important because it affects a lot of people. And unfortunately, it is also a condition where there isn't a lot of advances in terms of therapeutics in the form of drugs. So therefore, it behoves us to really learn how to prevent this condition. And also, in a way, when we have this, if someone has this condition, what are the other treatment we have that has been proven to work? They are not by medication. And hopefully, after this talk, you will still know that there's actually hope for people who have osteoarthritis, and we need to also see how we can prevent this seriously. So it is actually a common age-related disorder, and there may be at least 3 different groups of osteoarthritis. One is the more degenerative wear and tear kind, which happens in most people in their knees. And this actually occur over 65 years old. In fact, 1/3 of people who are above 65 may actually suffer from osteoarthritis somewhere in the body. The other group is actually the more bone-forming type and a bit inflammatory. And that actually happens in the hands, especially around 55 to 60 years old in females. It actually happens more in the hands, and it's a little bit inflammatory in the sense that you can even notice the joints being a bit red and swollen for a few years. And then there's one group that is erosive, which means there's actually a little bit of damage to the joints as well, although that group is a bit less common. So in a way, it's not just one diagnosis, it's probably a group of diagnoses, but we generally put them together and we call them osteoarthritis because it tends to cause joint damage, and as a result, there's loss of mobility and function of the joints. And oftentimes it can be quite debilitating. In fact, it's probably one of the biggest cause of mobility issues in older people. Now, what we realize is that there's dysregulation of normal tissue turnover and repair, resulting in joint failure. And I think the structure that is affected here will be the cartilage and also the subchondral bone. In other words, the bone beneath the cartilage. And both actually can have problems with turnover and tissue repair, resulting in the wear and tear that is more permanent. And as a result of this damage, there can be the entire joint organ failure and not just the cartilage. So there can be damage to the not only the cartilage, but also the bones underneath the cartilage. And there may be also joint swelling occasionally and so on. And as mentioned, it affects the knee, certainly the hands, and also very commonly affects the spine and also the hip. But in the local population, the hip is less commonly affected, unlike the Caucasian population. So in terms of the pathogenesis, in other words, what caused this condition, actually, we don't really know 100%. But we know that it's mechanically driven and biochemically mediated. In other words, there is actually some malalignment of the joints or uneven loading of the joints. So there's a mechanical reason for part of the joint being overly worked or having a lot of mechanical load. And because of this, there is actually some biochemical derangement resulting in inflammation and subsequently damage of the joints. And so it's therefore not totally without preventive measures. We can actually try to slow down the progression, and I'll share more about that later. And because of the fact that it is mechanically driven, some of the interventions are actually how to correct the uneven loading on the joints, and that actually can delay the progression of the arthritis. And of course, some of the medication is actually targeting the biochemical derangement. Again, I'll share more about that later. And although we know more and more that a few important chemicals and hormones like leptin and metalloproteinases and cytokines are all linked to the wear and tear of the joints, but unfortunately, until today, we don't have a magic bullet that can be either taken orally or injected to treat the condition. This is unlike some of the other more well-known conditions like rheumatoid arthritis, psoriatic arthritis. You may have heard of it. Today, we actually have biological agents that target the inflammatory markers, and we can treat the condition with a more targeted approach. But for some reason, for osteoarthritis, it's not so simple. We haven't found a magic bullet yet. So this is one of those hands that I talk about where you can see there's actually some swelling around the tip of the fingers, and we call this Herberton nodes. And this another swelling around the middle part of the finger, we call that Bouchard's node. So it is characterized by bony swelling, and these are what we call osteophytes. And in the hands, it can cause pain, especially around 55 to 60, and then after a while, it may quieten down. But whatever hard bony swelling has happened, it tends to remain. And there may be mild sort of a bit of contracture of the tip of the finger, but usually the patient is still able to use her hand fully. So it's not as debilitating or destructive as, say, rheumatoid arthritis in the hands.